Welcome to The Inside Track, where we talk all things health, healthcare and medical insurance. Brought to you by TRA and our team of Warren, Alan and Doc Avron. Let's sit back and see what our team has for us today.
Hi everybody and welcome to The Inside Track. Can't believe that it's already episode 4 that we're doing, and the response has been phenomenal. So we're very happy for that. We're very encouraged by the number of views we've had. We've had interaction with us as a team, and we're all very excited for the podcast. So let's jump into today's episode. Let me start with you, Doc. Last week we saw part 1 of that discussion with Dr. Saffer, and we spoke about the crisis facing South Africa in terms of mental illness. I believe we've got a part 2. So maybe you want to just tell us a bit about it, and let's listen to what you had to say.
Yeah, I'm super happy about part 2. There was just so much information, and we've just had such a great response on part 1. And I'm so happy that we have a part 2. Part 2 actually unpacks it a bit more, the depth, and actually it's got a lot of the models and the to-dos. You know, it's all well saying, well, we've got this mental wellness crisis and people have mental wellness issues, but what do they do?
Sure.
What are the red flags, how they get followed up on? So I'm super excited about this part 2.
Great.
And we'd love our listeners to hear it.
Great. Well, let's have a listen to Dr. Saffer.
So little red flags and saying that people shouldn't ignore, right? And that's really what I want to ask you, is that people feel, and maybe it's not true, but you can tell me if it is true. I think that people still feel ashamed or afraid to ask for help. What would you say to someone who's unsure whether they're feeling it serious enough for support or to reach out or ask for help?
Well, first of all, there's a great organization called SADAG, S-A-D-A-G. It's the South African Depression and Anxiety Group. And they've got people on the phone. I think it's a toll-free number, 24 hours a day. Maybe you can broadcast their number.
I think we will. We will put it onto our podcast for sure.
Because that's somewhere where anybody can phone in and ask questions and at least be guided to the next step.
Right. But should they,
Hmm?
do you think people still feel ashamed to ask for help? And what should they say to themselves that they shouldn't feel ashamed to ask for help?
Sure, if people feel ashamed to ask for help, I think it's probably a very specific sort of type of person.
Right.
And, I don't think it needs to be asking for help. I think it needs to be a curiosity about one's health. I think that there are people, and I see patients in my own practice, people who just carry on no matter what. They put one foot in front of the other. I've seen women in my practice, working in high-powered corporate jobs, and when I check their iron levels, they're almost 0, and I'm quite surprised that they haven't fainted and passed out on the couch, but they're still managing to lead huge corporate deals. So I think it really depends, but I think that if one feels that there's something that is out, it's better to find out. Be curious about it. Ask your GP, phone a hotline of some sort, even Google it, just find out more.
Right. So to answer my question, when is it time to seek professional help? You would say for any red flag, you should actually try and seek out some help just to check it, right? And see if it is an issue or not.
Oh, and I think I want to bring the point now is that not every red flag points to a mental illness. That's why psychiatrists like me do medical school and become doctors before we specialize in psychiatry. Because, for example, if a person has got something like iron deficiency, you'll become very, very fatigued. Does it mean you're depressed? No, because the reason will be an underlying issue with your iron. So, when I see patients, I regularly send them for blood tests to make sure that there isn't a physical cause of the underlying symptom, which could be a mental illness symptom.
Right. So, Shana, to explain for our listeners, they're probably thinking, okay, let's say they reach out and it's not a physical issue. What does professional help look like in the psychiatric and psychological sphere? If someone's got a clinical depression or anxiety, what does that type of help look like?
So it really depends on the person and on the symptoms and on what, what the sort of help they want is. But it goes from practices that are more psychological or more grounding, all the way through to going on medication and being admitted to hospital if necessary, if the person has become that dysfunctional that they're not coping at all and they're not maybe able to care for themselves anymore. But that's on a continuum. So the small things might be just teaching people healthy practices of releasing stress. I use a lot of breathing techniques, yogic breathing techniques. If you want to de-stress, all you have to do is block your right nostril with your right thumb and breathe in and out slowly through your left nostril for 3 minutes. Anybody can do that, with their phone timer on, for example. And believe you me, that works. Another tech.
Sorry,
no,
I was
no,
just
no.
going to say, which you're telling us any practical steps for people to manage their stress, anxiety, and support their
So
mental wellness.
these are things called distress tolerance that one can use in the moment to ground one and to actually calm one down. So, for example, there's a technique called the 5-4-3-2-1. And in essence, what that is, when someone's feeling panicky or uncomfortable or starting to feel like they're hyperventilating or feeling out of control of their emotional system. So we call this being pushed out of your window, perhaps into what we would call a fight and flight response. We get kind of quite adrenalized and hyper anxious maybe in the moment. So something called the 5-4-3-2-1 is a practice designed to ground one back to a level where you can breathe properly and where your brain is functioning again. So 5-4-3-2-1 is simple. You can do it anywhere. What are 5 things I can see? And if you're just even in a dark space, you can see your own palm of your hand. You can see a ring on your finger. Otherwise, write them down. I can see a book. I can see my computer. I can see a carpet. Wherever you are, write it down. 5 things I can see. 4 things I can touch. 3 things I can hear. 2 things I can smell. And 1 thing I can taste, which is generally taste your own mouth. What do you taste? Now, just going through those few steps, you turn around afterwards, especially if you write it down, and you find that you are more grounded.
Wow.
So this is something one can do, for example, without medication. Other people might have a pill in their pocket and put a pill under their tongue.
Sure. I think it's very useful, and I think those are important techniques. And I think the message you're bringing home here is that one should obviously look into techniques that can reduce your stress and anxiety that you're feeling on a daily basis before it becomes a red flag issue.
So that is exactly. So I don't know if you've heard the term mindfulness.
Yes.
But mindfulness is a term. I mean, John Kabat-Zinn from Boston came out and taught a bunch of people out. We're talking the early 2000s. I know I met him in 2008. And now mindfulness has become sort of a lingo in mental wellness. And what we do know is that mindfulness, and I'll explain what that is, mindfulness, which is the practice of moment to moment, non-judgmental observing. So it can be observing anything, observing the wind in a tree. It can be observing how the breath goes in and out your body, but with no judgment. We're not judging, oh, I'm breathing too fast, I should be breathing slow. We're just looking at what is. And there's many ramifications of how to practice mindfulness, but the point is that on a physiological level, mindfulness raises a particular brain hormone or neurochemical called serotonin. And when serotonin chemical is actually stimulated and the circuits of serotonin are going faster, we feel calm, we're more tolerant, we're more patient, and we feel more grounded. And the same can be said for listening to relaxing music. There's certain music that stimulates our serotonin.
Such an important message, and I think this topic is so vast, Shana. We'll have to bring you back. But a final takeaway, if there's one thing you want our listeners to remember about mental illness and seeking help, what would it be?
I would say that everybody deserves to feel well, and everybody deserves to not suffer. So if you are suffering in whichever way, whether it's too much worry, whether it's feeling that your brain doesn't work, whether it's feeling that you can't sleep, your appetite's not good, or you're just not connecting anymore with your friends or with your family, you deserve the chance to feel good, and you must pick up that phone and do whatever you need to. Contact your doctor, contact the South African Depression and Anxiety Group, and make that call.
Fantastic. Dr. Shana Saffer, specialist psychiatrist with an integrated emphasis. Thank you so much for your time. And that was very interesting and meaningful. We really appreciate it.
You're so welcome. Thank you.
Wow, that's fantastic and such practical advice.
Amazing.
I just love the fact that she gives you something to do when you're sitting in a crisis. There's stuff that you can do, you know.
Yes. And Warren, just to say that, and Ellen, I mean, the whole point about our podcast is to come up with to-dos, right?
Correct.
Putting out the information. So we want to aim that on all our information that we give, but there's some to-dos. So I think there were some great to-dos and some learnings, and it was fantastic.
Empowering our listeners is a very, very good trait so that people know how to deal with these issues at the end of the day.
Sure.
Yeah.
I think, Ellen, let's move on to your slot. You know, you've got so much wealth, a wealth of knowledge on this healthcare industry of ours. But let me ask you a question that we've been asked. It's very pertinent, and our viewers want to know something quite important about a medical aid. Why must I use the network on my medical aid? So, well, what we've done is we've unpacked it into a couple of questions. Let me put these questions, and you can give us your insight onto that. So, first of all, let's just set the scene and ask, what exactly is a service provider network in the context of medical schemes?
Thanks, Warren. A service provider network is a conglomerate or a group of networks, i.e. primary care doctors, specialists, tertiary from a hospital point of view, or group of pharmacies that is contracted to provide a service to the medical scheme member.
Okay, great. So it's effectively the network your medical scheme uses to provide services. And that's really what they're trying to do. And obviously, you've now got this network. So how do medical aid scheme members, so we talk about the consumer themselves, how does the consumer benefit from these networks?
Warren, members and doc members benefit through a reduced out-of-pocket expense. Normally, benefit options is designed around these providers, so there's no co-payment for the member. The member then knows what he's going to pay, predictable billing in terms of his billing, and assurance that the outcomes, the quality outcomes, is measured by the medical scheme. So you're almost guaranteed that at the end of the day, you're going to get the quality outcomes that you want from these providers.
Okay, great. And then obviously, let's look at the other side of the coin. What are the advantages for the medical scheme? I mean, why would they themselves insist on members using the network?
Yeah, healthcare is in our country is quite an expensive, particularly private healthcare is quite expensive. And, the rand that members invest in their health is the medical scheme's prerogative to manage as best as possible. We know that medical schemes pay more or less almost 90% of funds to providers. And it's important that medical schemes have mechanism to manage the cost drivers.
Okay.
So there's a number of cost drivers in the industry, and those cost drivers are best managed through networks.
Okay, I mean, that makes sense.
Makes sense. So we're saying that it benefits the member and it benefits the medical aid.
100%, Doc. 100%. And, sometimes members perceive it to be an inconvenience and a way for medical schemes to save money. That money just comes back into the member in terms of access to quality health.
Sure.
Does it benefit the healthcare provider?
it does benefit the healthcare provider. Number one, the benefit for the healthcare provider is almost a guarantee of members coming through the door.
Right.
Okay. He can then plan, or she can plan, or hospital group can plan. In X geographic, there's X scheme members, and we can expect X of them to have a certain percentage of chronicity, and they can manage their hospital admissions according to what the geographic profile looks of that medical scheme. And that's important because it allows the entire continuum to be more efficient.
Right.
Sure. And obviously there's another obvious question. What are the downsides to using a network or being forced? Because that's really how
I
it's viewed.
suppose, yes.
I'm forced to use this network. What is the disadvantage?
There shouldn't be really downsides, but there's a perception that there's downsides. Medical schemes contract providers in a 50-kilometer radius normally. That radius is ensured that everybody that's in that network has access to quality healthcare.
Okay.
In terms of that provider. So the perception is that I'm being restricted. It's not actually true. The flip side of the coin is where there is no provider, networks make provision for out-of-network consultation, be it the primary care provider, be it the pharmacy, or be it a hospital. There's always provision in the contracting, Warren and Doc, in terms of providing access to quality healthcare for medical scheme members. And that's important for members to understand. You are not restricted. You are given an opportunity to access quality healthcare at an affordable cost. You are given access to ensure that quality is managed at a reasonable price. And that's definitely a win-win for both member and medical scheme.
Sure. And I mean, in terms of we're living in a tech-rich society, how are provider networks evolving? Well, is there something new happening in that space?
Yeah, definitely. I mean, virtual health has been around for a number of years now. It's not really something new, but it has come into the sort of network space. You'll find that virtual consults are much cheaper than physical consults. You can actually start with virtual consults, nurse-based consultation, and dial it to the doctor where you need more specialized knowledge. And the doctor himself can then, where it's a primary care doctor, can refer you to a virtual consult in terms of specialization. And that's the benefit of technology. Even pharmacies can look at the script and look, this is the best medicine, but we have in your basket of medicines, we have what's the right word now?
Formulary.
A formulary of medicines that makes it even more affordable because the active ingredients in that formulary basket of formulas is exactly the same. So it is very, very important that as the world evolves, virtual consults in all spheres will become more and more. You can find sometimes doctors sitting in India giving advice to his colleague in South Africa through virtual consults, and that's how the world evolves in every respect.
And I guess that wouldn't happen if we weren't focusing and putting our resources into maintaining these networks.
Exactly.
I think if everyone was doing their own thing, you wouldn't have that level of technology coming through. So definitely makes sense. And I guess if you, again, looking from the consumer point of view, we need to move away from networks as being a rule and more a benefit-driven choice as a consumer. You know, you are choosing to use the network. There are advantages to doing it. So why not? You know.
Yeah, I mean, I think if a member say wants to go to Dr. X and they're not in the network, then they'll pay a premium for that, and that's fine.
Sure.
You should have the choice of that.
Yeah.
But if you want to be on an affordable option,
Correct,
and be able to, then you're obviously going to have to go with that network.
100%.
Sure.
Pay a premium that's commensurate with that benefit option.
Sure.
Yeah.
And then, Doc, tell me something in our gap cover environment. Would the same thing apply?
Well, I think a network in a gap cover environment could be a very exciting development. It would really be a back on the medical aids in their network, and I think there could be a great opportunity there. Yeah, I think there could be something very exciting.
I think what we're alluding to is watch the space, because anytime there's something exciting that we can get our hands on, we're going to go there. So yeah, watch the space and see what we have.
Exactly.
And and again, this all leads again into our Gap Cover 101. We've had such a great response to Gap Cover 101. We're teaching consumers about Gap Cover. So let's look at some more of the questions that have been raised with us.
Right.
And they've all sort of, these three questions are all interrelated in terms of what the consumer would perceive a gap cover should cover, but we know that in terms of the way the product is structured, it's not really going to cover it to that level. So the first one, are medicines covered by my gap cover policy? Now, we know that medical aids would have contracts with medicine providers through formularies, as we mentioned earlier, and there should not be those shortfalls for members to face unless they are going outside of
The network.
the network. You know? So
That's
again, it comes back to that network question. Are medicines covered by my gap cover policy? No, it's normal medicines and shortfalls on the medicines are not covered, but your medical aid should actually be the provider of those benefits. So,
Or if I could maybe add to that, gap cover is designed to cover your high risk,
sure,
and ensuring your health is a risk, and ensuring your health through your medical scheme is more designed around your risk factors than primary health care. But primary health care is a benefit for your day-to-day expenses and your day-to-day consultation, and gap cover is not designed for that.
So that leads into the other two questions we've got, and they're both the same. Is dentistry covered, and are my normal consultations covered by my gap cover? So clearly your run-of-the-mill day-to-day consultations, either at a GP or a dentist, that's not covered under your gap cover policy. But within for dentistry, for example, if there's some sort of dentistry hospitalization, you've got to go for your medical aid is approved. That something like a wisdom teeth extractions, things like that. And certainly if your kids are going into hospital for some sort of dental work, then we can look at covering those shortfalls.
Correct.
And in terms of consultations, where your service provider actually visits you in hospital, so you've had your procedure or your treatment, they come to check on how you're doing, and that sort of consultation will cover shortfalls there. But the general question of, does the gap cover policy cover my dentistry and my GP consultations? Not at this stage. So
and I think we've mentioned it as part of our 101. Gap cover is not medical aid, and we always emphasize on that. So a supplement to your medical aid, where there's shortfalls in specific circumstances. A large predominance of that is in hospital. But it's not a medical aid.
Sure.
And I think as part of 101, members need to understand that.
100%.
And I think these questions that we get, there's so many of them. So if you as the viewer want to send us more questions, you know the address by now. It's Ask Dr. Avron at totalrisksa.co.za. We'll put the address up on the screen. You can have a look at it.
Great.
And give us more feedback. Again, we've had such a lovely time today. We've actually looked at some very interesting information. The mental health crisis in South Africa is not going away, and we now have information that the average person can use to assist with that.
Exactly, Warren. And I'd like to say to our listeners, thanks for the questions coming in, and they should continue to come in at the address that's on the top of the screen. And also any other interesting topics. We've covered mental health. We've got a whole bunch of very topical health issues coming up in our next series of podcasts. So some very exciting interviews and developments. But if there are any particular topics you would like as a listener, please email us, let us know.
And then on our side, I mean, the healthcare industry, there's so many things that, again, the man in the street doesn't understand about healthcare, about gap cover, and we're going to constantly bring you the inside story. And I guess that's it from the Inside Track today.
And try to debunk them, Warren.
Absolutely.
Exactly. We had to debunk and tell our listeners the real truth.
Correct.
About what's going on, what's out there.
And I guess that's it from us at the Inside Track. And hand over to our friendly AI model, Gappy, as he has a few words for us.
Thanks, everyone.
Thank you very much.
Don't stress, the gap is covered. Well, there we go. Thank you to the TRA team and to you for watching the Inside Track. Until next time, bye for now.